Okay, so as promised, this is Chapter 14's Health and Illness recorded for your convenience. Okay, so why is sociology interested in health, right? How does something biological relate to something social and cultural, right? Well, in part because our bodies are social objects, meaning that our physical selves have socially constructed meanings, and the way that we understand our bodies is affected by social forces. So even the definition of health itself is very social. So we're influenced differently depending on where we live, by what statuses we hold, what society we're in, right? Different things will have different interpretations because of the socially constructed meanings around the body. So basically, the nature of health is determined by social rather than biological context. So, what does having a healthy body mean? Well, it means something different in the US than it would in Senegal, right? So there's a different, standard depending on the society. So it shows that the ideas that we have about health are very socially developed. So an example of that could be this vaccine scare that's been going on lately, where people are like not having their kids vaccinated because they heard that there's some sort of link to autism or something of that nature. So they, are choosing not to vaccinate their children, which are putting a lot of other kids at risk, and they're putting their child at risk of, contracting easily eradicatable diseases. So it shows that it's not necessarily based on a scientific or health perspective. It's based on a social consensus that comes from these people that hear, half truths or pseudoscience that convince them that it's a harmful thing for their children, right? So, again, the kind of understandings that we have are very much based in the social rather than biological. When it comes to definitions of health and illness, there's a couple different kinds of illnesses. There's what they call acute diseases or those that are chronic. So acute diseases are ones that have a sudden onset and might be brief or incapacitating, but they're either curable or fatal. Kind of like the one I have right now. Pretty sure it's fatal, but I'm just kidding. Basically, these are things that have a sudden onset. So they either, you just kind of get sick one day, right? That would be an acute disease. A chronic disease is one that develops over a long period of time and may not be detected until symptoms occur later in the progression, such as cancer or diabetes, right? There's ways to prevent them, but they're typically kind of long-term issues that arise over time. Also, there's different kinds of approaches to medical treatment. There's what's called curative or crisis medicine. So this is a type of healthcare that treats the disease or condition once it's manifested. So kind of going back to that, chronic diseases. Once something has manifested itself, you go to the doctor, you're super sick, they give you medicine. That would be like a curative or crisis medicine. Preventative medicine is when you try to avoid getting sick in the first place, right? Or stall the onset of a disease by taking preventative measures, such as lifestyle changes like, eat better, exercise more, like things like that, which can, of course, affect, some of those more chronic diseases like diabetes. You can stop them from developing in the first place by putting premiums on preventative medicine. So, as we talked about a little bit in class, with the Affordable Care Act, um, one of the provisions that they put in place was to provide more preventative health screenings for free or low cost so that, basically in other countries where they focus more on preventative care, people don't develop as many chronic illnesses. So, by making these things cheaper and more affordable to people, you have a lot of poor people that did not have health care until the Affordable Care Act, and they would simply just wait until they were so sick that they had to go to the emergency room, right? Which, because of those kind of high spikes in pay, that affects everyone's insurance premiums. So providing preventative medicine is not just better for the person, but it's better for the financial system of medicine itself. Also, there's palliative care, which is a type of healthcare that tries to focus on symptoms and pain relief, that provides a supportive environment for someone that's critically ill or dying. So, instead of fighting the illness or disease, you get to a point where someone's on their way out and you just try to make them comfortable, happy and comfortable before they die, right? So that would be palliative care. So also there's this issue of medicalization when we understand the social construction of health and illness. So medicalization is the process by which some behaviors or conditions that were once seen as personal problems are redefined as medical issues. So, for example, ADHD used to be one of those things that it wasn't considered a medical problem. It was considered you can't sit still, that it's a personal problem, that you need to, just have more discipline or, focus harder. But what they know from, a lot of research that they've done on children or young adults or adults that have ADHD is that the more you make them try to focus, the more distracted they get, right? That distraction can often help them concentrate. So, that was something that was considered a personal problem, but now we see how many people have it and how it affects our education system. So it's now considered a, disease or medical issue. In a similar way, obesity used to be considered just a personal problem, like maybe you should change your diet or maybe you should get more exercise or something of that nature. But nowadays, because of the influence of, in the post-70s food world where we have all this fake food, these junk food, as they call it, where, it's kind of laced with high fructose corn syrup and a lot of kind of insoluble things that our bodies can't digest as well, that it kind of shifts from being a personal choice to being an issue with not having a sustainable food culture that gives people healthy foods, right? So we know that if you're poor, if we talked about the concept of food deserts before, where a lot of poor people don't have access to healthy organic foods. So, they are more likely to, because of financial necessity, eat at fast food places, or, if they're trying to shop for food in their local neighborhood without, making it a huge hassle and expenditure to go find a grocery store that's close to them, then they're more likely going to end up at 99-cent stores and mini marts and liquor stores that don't have the kind of food, mostly just processed, packaged, sodium-laden or sugar-filled foods that aren't good. So again, when we kind of look at the larger structural things that are causing people to be obese, the fact that the obesity rate is kind of out of control in our culture, it shows that it's not necessarily someone's individual choice as much as it's a issue with the culture and its approach to food. So, medicalization in general changes the meaning of a condition and the meaning of the person suffering from it, right? As we now see it as a condition instead of like, hey, sit still in class, or hey, don't eat that food, right? We start to understand how these are medical disorders. Another example of this that we can see is the changing meaning of HIV/AIDS. So diseases can be socially constructed and change over time. So the social meaning of AIDS has shifted significantly since it was first discovered in the 80s. At that time, AIDS was very poorly understood and was very stigmatized because it was associated with marginalized groups, specifically gay men and IV drug users and Haitians. So at first, there was no effective treatment. The prevention through safe sex was the only safeguard against the disease. But by the mid-90s, a drug cocktail was developed to help HIV-positive patients prolong their lifespan significantly. But see, it was the kind of deviant understanding of those that had AIDS that meant that there was a very slow medical response to trying to eradicate the disease because it was attached to marginalized people. People like IV drug users, right? There's not a lot of people out there trying to defend IV drug users. Also, gay men at the same time, they were very stigmatized in the early 80s. So a lot of people felt like, oh, it's a disease that only targets homosexuals or only affects IV drug users. Well, then good, because they're two marginalized groups that they didn't really care about. So, that kind of shows how the social meaning of the disease changes, right? Once we started to acknowledge that, oh, it's not just IV drug users or gay men that have AIDS, right? It's a lot of people. And the fact that a lot of people actually got AIDS from blood transfusions within hospitals, right? Before they were testing blood that people donated for these kind of viruses. So there's a lot of people that they just went into the doctor for a medical procedure and they came out with this disease. And they're stigmatized because they're labeled a deviant because it was associated with these deviant subcultures, right? So, it wasn't until later that they kind of realized, oh, there is no particular sexuality, there's no particular group of people that, face this issue. So they developed more drugs to kind of combat it and, more public awareness campaigns to try and talk about the issues related to HIV/AIDS. But, it's sad it has a lot to do with the stigma around it. So there's been recent increases in HIV as people are now becoming more lax with safe sex practices, and transmission rates had lowered. So now the disease is seeing an upsurge in occurrence, especially among like the millennial young population that think, oh, that's not going to happen to me, right? That's a thing of the past. But really, it's something that we have to kind of remain vigilant against in order to get rid of diseases like that. When it comes to HIV and AIDS around the world, it originated in the Congo, right, and moved to Haiti and came from there to the United States. So it comes from the version of AIDS, which is SIV, right, the simian version. And that's been present for about 30,000 years before it mutated into HIV, which affects us. So since it's become a disease, over 25 million people have died from AIDS since the discovery in the 80s, and currently 33 million people are infected with HIV virus. So it's important to understand transmission rates to try and figure out how people get it in the first place and what behaviors and situations lead to increased transmission so that we can, prevent that. So HIV/AIDS is not distributed across the world equally. Only about 4% of cases are found in the developed world, meaning in the US or Europe, Japan, or other wealthy industrialized nations. So in the developing world, HIV patients have, in the developed world where we live, HIV patients have access to antiretroviral drugs. So that can turn the disease into a chronic condition that can be managed, right? Like you have people that have had the disease for a long time, like someone like Magic Johnson, who came out in the early 90s saying that he had the HIV virus and that, because he's wealthy and he's able to have access to these antiretroviral drugs, he's still in good shape and he's, been able to kind of manage his condition. But the overwhelming majority of cases now are found in the developing world, where access to medicine is barred, largely because of access or oftentimes because people don't have money to afford the medications that they need to prolong their lives. So basically, sociologists are interested in the social aspects of disease patterns, so how it is that they spread. So epidemiology is the study of disease patterns, really to understand the causes of illnesses and how they're being spread, so that we can plan some sort of intervention to stop the spread of illnesses. So different kind of words that relate to how these patterns, how these diseases spread. One would be an epidemic, which is when a significantly higher number of cases of a particular disease occur during a particular time period, more so than would be otherwise expected. So we had that Ebola thing a couple of years ago, right, where there was a lot more cases than expected, and it was considered something that, while it was still pretty regionally specific, they were afraid that that epidemic that was going on would become a pandemic. So a pandemic is when a significantly higher number of cases of a disease spread throughout a large geographical region, right? So basically, they were like quarantining people coming from different areas because they were afraid that it was going to spread to the US, right? So that would have been a pandemic if it would have spread, where large geographical regions spanning many countries and even continents would kind of be affected by that same disease. So often when we deal with epidemics or pandemics, there's vector organisms, these animals that spread the pathogens or germs in an area, like mosquitoes, ticks, birds, that spread these things across large areas. So that's why right now the big one that people are talking about is the Zika virus, right? And that's also linked to mosquitoes, which can cause like encephaly and kind of issues with babies. So it's important to understand how these things work and how they spread so that we can kind of mitigate and limit the consequences of those health outcomes. And of course, when we're talking about it through a sociological lens, health and illness, we have to look at how, your social position in society is going to affect the kind of medical care you're going to receive, meaning looking at the intersections of class, race, and gender. So people with the higher social class are going to be able to afford the best possible medical care, right? There's also, so that means just that the poor people are not, and oftentimes are going to, kind of face consequences by not having the ability to pay for the medical care they need, even though we are the only industrialized first world Western country that doesn't have, universal free healthcare. So inequalities in gender and race are also related to socioeconomic status. But when we factor these in, we find there's wide discrepancies in medical care and treatment. So minorities, for example, are less likely to be able to afford medical care, which is going to affect their overall health. So you see differences in, um, length of span of life. People are more likely to live in areas where there's a lot more chemicals, or work in industries where they're going to face more kind of environmental hazards, which is something we'll talk about again with chapter 14 when we talk about the environment. But anyway, it just shows that depending on your social standing in society, that's going to affect whether or not you get good quality medical care. So gender can also be an issue for men in medical care, as men are more likely to avoid the doctor and not take symptoms as seriously as women. So some people argue that that's related to this kind of hegemonic masculinity that says men aren't supposed to ask for help, right? So going to the doctor is a way of asking for help. So I don't know if I told you guys about that. I think I did, about my dad and how he like threw out his shoulder a couple months ago, and he literally couldn't even lift it up to like brush his teeth, like his arm. And my mom's like, go to the doctor. He's like, I'm fine, it's fine. And she's like, you clearly need to go to the doctor. You cannot lift your arm, right? But he was being super stubborn about it. So she like called, made an appointment for him, and like physically drove him down there. And he ended up needing some shots, and now he needs a surgery, right? So it's basically, yeah, he did do some damage. He needed some help. So it's interesting that, a lot of men do this, where they don't take their symptoms as seriously as women do. So they get these prolonged diseases, so that by the point that they have a diagnosis, they could have been prevented or treated at an earlier point with, regular medical attention. And oftentimes there's consequences for waiting that long. So that can affect the kind of gap between men and women and, expected life, expectancy. Okay, so also there's the problem of food deserts that I kind of already talked about a little bit. Having access to healthy food is very important to your health. So a food desert is a community where residents have little or no access to fresh, affordable, healthy food, which are usually located in densely populated urban areas where you end up at the local mini mart instead of, being able to find like a Sprouts or a Trader Joe's or something like that. And this can lead to what they call deprivation amplification. So this means that you might have some individual disease risks based on your genetics or your bodies, but that they can be amplified by social factors. So for example, if you are a person of privilege versus a person that's marginalized, right? That person of privilege might be able to have the best food, live in an area with best, with good, clean, water and air, access to those kind of things. They might live in a neighborhood that has no landfill next to it, right? Or, coal ash plants or things of that nature. They're more likely to live in areas that they're not going to experience asthma and those kind of consequences, right? For living in polluted areas. So it just means that the privileged people are going to not have as many disease risks because genetics it's an interesting kind of thing. Your genes can be turned on or off, right? Depending on how you live your life. So this just means that if you're more marginalized and you're, grow up in an area like Southern California, like the LA basin, right? I think you're like 4 times more likely to have asthma as a result of just growing up in an area with a lot of smog, right? But of course, we'll talk about it in chapter 15, but there's this concept called environmental racism where, especially the poor, minorities, and people of color, other, marginalized groups are more likely to live next to polluted areas, meaning, like byproducts of industry, coal ash plants, landfills, things of that nature. So of course, that's going to mean that you're going to have more health risks, negative outcomes than people in more privileged areas. So it just means that your genetics basis of what you have at birth can, definitely be affected by your social environment, whether or not those genes are triggered or not. So medicine itself is also a social institution in society that kind of gives us certain explanations and meanings. So part of this is the American Medical Association, which is an organization that we think of it as a medical recommendation organization, that they issue these kind of recommendations on what to do about cancer or childhood diabetes or things like that to benefit the general public. But the AMA is also the trade union that creates the rules and regulations around medical licensing. So it's been criticized for being an organization that advances the interests of physicians and not patients. So some argue that it monopolizes care So it doesn't let people, like, for example, from other countries that have medical degrees practice in this country without taking specific tests. And there's restrictions against home births because doctors don't make profits, from that. They make profits from hospital births. So, some of those examples. But the organization itself creates these norms and values of the practice of medicine. So it regulates the industry and promotes certain policies. So it has a lot of power to kind of, set up our expectations about medical care. So this leads to what they call the power of the situation, or the power of the institution to define the situation. So sometimes medical institution a person is put in can define how they're socially understood. So for example, if you're committed to an insane asylum or mental hospital, people who argue that they are sane there are pretty much ignored, right? Because it's that idea, like, they're like, okay, crazy. You're like, but I'm sane. I swear it, I'm sane. There was a mix-up. I shouldn't be here. They're like, yeah, sure, okay, crazy, right? But it shows that the power of the institution to label someone crazy is going to stick, right? It just means that even if you are rational, and there's been a lot of cases of that, like One Flew Over the Cuckoo's Nest kind of narrative, where people have been locked up in institutions by mistake, but since the institution defined them as crazy, they're now crazy, right? So others argue that being in the hospital can be its own role issue. So, oftentimes if you're in the hospital, you're not going to be listened to by staff or doctors because they are perceived as understanding your health and conditions better than you. So sometimes people remark that they're ignored, like that the doctors don't take into account the experiences and feelings that the patients have, which, you're kind of like the metric. Like if you take your car to the mechanic or something, he plugs it into a computer and that tells him what's wrong with it. Like we are the computer that says what's wrong with us. So it's kind of important that they listen to us about what we're feeling or experiencing because, they can kind of come in with their outside perspective. But if you ever watch an episode of House, you realize how much it's kind of like a trial and error assumption-based kind of practice. So, the role of patient typically makes us passive, and the role of doctor makes you active. So a lot of people feel like they're not taken seriously. That's why, like, in my own family, for example, like when my grandmother was really sick and in the hospital, I remember the family members would always like trade off who was there so that there was always someone there in the hospital with her so that she was receiving the care that she needed because we weren't confident that she would otherwise, right? And, another example, a friend of mine used to be my roommate that had like a bunch of holes drilled into his brain, long story. Not his brain as much as his head, but whatever. And like shunts put in and such. That I remember one time the nurse gave him the wrong meds because she didn't like check the chart. And I showed up like 20 minutes later and he had like the gnarliest seizure I've ever seen a person have. Like, I was pretty sure he was explode dying. So, yeah, that was the day where we were like, okay, me and my other friend sat down and like, okay, who's going to be here at all times? So we make sure that he's taken care of, right? So even there's all those issues where a family often will kind of camp out within hospitals to make sure that their loved ones are being taken care of effectively because of that kind of patient role where they don't really pay attention often to the patient. And this relates to this kind of overall doctor-patient relations. So it just means that the institution of medicine, the meanings behind it, structure our understandings and interactions between doctors and patients. So the setting, like, when we talked about with the Milgram experiment, right? Like some people are really influenced by the kind of guy in a coat telling them what is or what isn't. And so, though people do often fight back against this, so, oftentimes doctors have to assert their status because they're not always perceived as dominant. Like some people just come in with like their WebMD understanding and are like, well, no, I'm pretty sure I'm dying, right? That's what I do. I'm like, I'm pretty sure I'm dying. Do all of the tests. And they're like, you're fine. I'm like, just do one more test. So, what's interesting is that the interaction that happens within the institution can shape the institution itself. So if doctors feel like they're not being respected, that can change it. If patients feel like they're not being respected. So it's a very interactive process, but that it shapes the kind of meanings within the institution. The sick role are just the actions and attitudes that society expects from someone who's ill. So it's a very functionalist idea that sees being sick as a dysfunction. So your sick role exempts you from your regular life, meaning you don't have to go to work or school or whatever until you get better. So this has changed over time now that we can kind of, use genetic ideas to predict who's at risk for developing certain illnesses, which changes the understanding of the sick role. But mostly it's just kind of like an excuse you can call in sick to something, right? And then we kind of have to just let it go that you're sick. And like, at least personally, if in regards to this class, if you're sick, don't come. Don't give us your germs, right? I'm the only jerk that does that, only because I feel like I kind of have to go for some reason. Okay, so when it comes to healthcare reform in the US, this is that video I showed you in class, which I suggest, you watch again if you're trying to parcel out the differences for your sicko paper between what was brought in with the Affordable Care Act versus, what was normal before that. And as far as the rest of these issues in medicine and healthcare, rescission is the practice by insurance companies of canceling coverage after a person gets sick, right? Something that he talked about within sicko, how, they could try and find the pre-existing thing to knock you off, or they would that story they said in sicko about the woman that got a yeast infection. It was considered like she got denied for a surgery she had already had, but they denied payment. So rescission is a kind of, unfortunately, common practice by insurance companies where they try and cancel coverage after a person gets sick so they don't have to pay for it, because paying for it is what they said in the film is a medical loss, right? Which is crazy. Anyway, and then there's a couple different kinds of medicine as well. Complementary medicine is where you basically, it's just like a group of medical treatments, practices, and products that are used in conjunction with our conventional Western medicine. And alternative medicine is a group of medical treatments, practices, and products that are used instead of a Western conventional medicine. So I have an example of that. I went to Santa Barbara once and had this lady, my aunt was telling me all about, oh, this lady's so great, and she makes this tea, and you'll feel fantastic, and blah, blah, blah. And I was like sick as hell. So I went to this lady, and she no one warned me. Let me just say that. No one warned me. So I go in there, and she just kind of sits across from me, which is like real close. And I'm like, that's weird. She takes my foot and puts it in her lap, takes my shoe off, my sock off, and just starts squeezing my foot to figure out what was wrong with me, which was crazy effective, actually. She figured out 2 or 3 things that were wrong with me that I didn't know that were wrong with me, that my doctors didn't know what were wrong with me. And then she sent me home with a couple bags of tea that were not cheap. But, she was a person that she had previously been a physician, but she did her specific research on, indigenous and native cultures, medicines that they used that were local to the area. So that's kind of what she incorporated for making tea. And so it's interesting that alternative medicine can be a great way, like with complementary medicine, to kind of supplement what's already existing within our conventional Western medicine system. It's just that conventional Western medicine rejects so much alternative medicine, largely because the FDA doesn't regulate it, meaning that they can't make money from it. So integrative medicine is really the combination of conventional medicine with complementary practices and treatments that have been proven safe and effective. So, without the kind of medical institution telling us that certain things how they don't call, they call some medicines supplements instead of medicines because they're not regulated in the same way as the kind of medicines through the FDA. So it's interesting how our social understanding of it, the kind of bureaucratic institutions that regulate it, also, affect our understanding of what kind of medicine we use. So also when it comes to medical technology and bioethics is the study of controversial moral or ethical issues related to scientific and medical advancements. So basically, the issue with bioethics right now is often with what they call, if you've heard of Monsanto, right? These organization that is kind of known for developing genetically modified organisms or GMOs. And so the issues with GMOs are that a lot of people have raised concerns that, for example, Monsanto produces what they call Roundup Ready crop GMOs. So meaning that instead of spraying Roundup on your crops, it has Roundup in the seed. So you plant the seed, the plant grows, and it has Roundup in it. So if an insect eats it, it dies. But it's totally fine for you, though. But you can totally eat it, right? No, don't ask about it. Why should it be labeled? You can totally eat it. I mean, it kills everything else that eats it. But it's totally fine for you, right? This is why people have a problem with it, right? Because they're a little bit worried about, well, why is it that we're trusting a company that developed Agent Orange and other kind of chemical products in the past for killing and maiming people is now, kind of trying to really not just pioneer, but control our food supply. In a lot of ways, Monsanto, actually, they just merged with Bayer. So now they're like the biggest company ever, at least in the pharmaceutical slash, food industry. But, they're really trying to do a couple of things that will radically change the food industry. Like first is monocropping, where you grow huge swaths of one crop. And what they do is their seeds are like a one generation seed. See, like in the past, people would, if they had like a farm or something like that, they would develop their seeds over a long period of time. And it was kind of like through a selective breeding, right? Like just like with a dog or a rose or a thing like that, you would selectively breed things to get certain qualities. Like, oh, I want this red rose. So I'll splice together all the ones that have the most red to them or something to develop these different colors. Or like with dogs, interbreeding them to develop kind of weird, you know, mixes of dog or something like that, right? Like that was kind of the natural way that we tinkered with the kind of evolutionary process. With this new situation with GMOs, it's completely different. It's more like you want to grow tomatoes, but the stalk isn't hardy enough. So you take like a gene from a fish and you put it in the tomato to make it more hardy, but then you don't really know what the kind of consequences. And again, like it's not as if there is so much medical proof that this is a problem. It's more that a lot of people say, well, shouldn't we have research on this before we start eating it all? So right now, you are eating genetically modified organisms. If you eat processed food, if you eat pretty much anything with corn in it, you're eating GMOs. There's been a lot of laws trying to label them so people know, like, okay, this one has GMOs, so they can make that choice whether or not they consume them or not, instead of being kind of like corporatist guinea pigs. But a lot of those things have been struck down. And actually, what's fascinating is they put in what's called the Monsanto Clause recently, with a couple of years back, with some sort of bill that was passed. Where they basically said that even if there are some sort of national standards for labeling laws, it won't apply to Monsanto, which is sketchy as hell. But anyway, so a lot of people have issues with this. There's a little clip I'm going to show you about it in the environmental chapter and globalization that talks about how this is affecting places around the globe. This isn't just an issue in the US. Monsanto is a worldwide corporation, but part of what they're doing is, like, going back to that example of the tomato, is that they say that if they splice something in that's different, that they then can patent it, right? Meaning that they can own life, like own tomato, right? Which is very different than like an automobile or an iPhone or a thing that like a people make and patent, right? Plants, once you start patenting life, food, are the things that we need to survive, then it becomes like, oh, well, if only that corporation controls it, it's very sketchy. So kind of going back to what I was saying before, they've developed this technology with their seeds. So instead of like farmers that would have seeds over generations, they'd have like their one kind of corn. And typically what happens is, if you've ever grown anything, and I hope you do someday, because it's pretty awesome when you have a garden, but it's a rewarding experience. Typically whatever you grow has seeds in it. Right? So if you grow those tomatoes, inside of it is seeds, and then you can plant more and start the whole process over again. So the ones that the Monsanto make are one generation, meaning that they don't produce seeds, so that you have to buy them every single time. Right? And they were doing these things, I think in the movie Food Inc., they go into this, which is a documentary on Netflix if you're interested, where they talk about how, sometimes there would be these farms that are next to these large agricultural business farms, like the Monsanto farms, where their crops, like the seed or the crop itself, would blow over from a neighboring field and, somehow cross-pollinate with the plants that farmer had had. And then Monsanto would come and sue them and say, this is our intellectual property. We have patented this. Therefore we can run you out of business. And they ran a lot of small farmers out of business using that kind of technique. So, yeah, when it comes to the ethics of it, there's a lot of issues there that are still being kind of worked out in the culture. Also, I decided not to show you the video. It's just depressing as hell. But eugenics is an issue that is related to this, that has a lot to do with medical science as well. So eugenics is an attempt to selectively manipulate the gene pool in order to produce and quote unquote improve human beings through medical science. So the idea is like, the survival of the fittest is a very like social Darwinistic idea, but this is very basically controlling it. So saying like, oh, we should get rid of all the sick people, all the people that have any sort of ailment or disability or anything, and just eliminate them from existence, right? So that's a problem. I mean, obviously we should strive to like improve human beings, but from a genetics perspective, that's pretty subjective, right? Like, how do you determine who is the best? Like, so if we were talking about in the beginning, how health itself, like what is considered healthy, is super culturally specific. So how the hell then do we decide who is the superior, perfect race that then all other people should be based on? Like, they did that. It's called World War II, right? It was called the Holocaust, right? Came about from this logic of eugenics, saying that, you know, certain groups should be privileged, that are they're better. And of course, this has a very racialized, a very specific racial hierarchy to it, right? With white people at the top, white European people. What's interesting though is that when it comes to eugenics, I mean, we've all heard of like the Holocaust, but most people don't realize that California actually pioneered a lot of the eugenic stuff that was later used in the Holocaust. So, you know, it's really sad. There's like a video I was going to show you, but it's depressing as hell. This that like a prominent eugenicist from that time period when Hitler rose to power was saying, you know, they're beating us at our own game, right? California's had a really bad history of eugenics where they basically would force sterilize women, um, you know, without their consent, basically make it so that they can't have children, often when they went into jail, often while they're delivering their children, right? They wouldn't tell them what was happening. They would just, you know, go in and give them a tubal ligation, instead of, you know, just delivering their child. So this was actually a practice that, even though it was, you know, ruled illegal years ago, it was going on until about 2010 in California prisons. So this isn't just an issue of like the turn of the last century, like in the early 1900s, the height of popularity was eugenics, right? Like all of the kind of social, you know, wealthy intellectual class all thought that these disgusting immigrants, right? They were going to take over, they were going to intermarry and you know, sperse genetically, and that all those terrible, gross immigrants, those terrible Irish, those gross Italians, right? Those Eastern Europeans, they were going to intermarry and do all that stuff, and it was going to like really just make, you know, cause a lot of, you know, biological problems, right? To make the gene pool a little bit, you know, shallower. And so, you know, it's important to kind of look at the history of it, how it affects our own culture and our own understandings within California, how this was still happening to Latinas that were being, you know, forced sterilized in prison up until 2010. So, you know, it has a historical legacy, but also has a current kind of legacy within, you know, California itself. So it's important to understand this issue of eugenics because, again, it comes from a kind of standpoint, like, I don't know if you guys have ever seen the movie Idiocracy, which I definitely recommend, right? It's especially after this election. It's like, just watch Idiocracy. It'll soothe what ails you. But, you know, in the film, the premise is basically like they take the most average person from right now, male and female, and they freeze them. It's supposed to be for a year. And they end up frozen for 500 years, and they end up being like by far the smartest people 500 years from now, right? And the argument is that like this eugenicist argument, kind of, not really directly, but just this idea that stupid people are having a bunch of kids, right? It's not really based on like in their narrative, it's like a redneck dude. But you know, it is kind of related to social class and those kind of expectations, but that it's still driven by that same fear that these like wealthy white people are very calm and like, oh, the market's not great to have kids right now. And wow, this other kind of redneck dude has like 10 kids by like 5 different baby mamas. And so it does kind of like, it's like the modern day version of that. But it is comical in the way that it approaches the issues of eugenics, of like what happens when we all become so stupid, right? But again, that's not, it's still really difficult to essentialize what is like superior. What is the standard that we should all be measured against? Don't we all think we are the standard that we should all be measured against? Like, who can really like objectively make that decision? You can't, right? So eugenics itself, it's like it comes from a place of like wanting to improve health, but it really does come from a place of racism and hierarchy and privilege of the people that are in power and privilege say, you know what, let's make the world look like me because I'm great. Instead of really realizing that like some of those other groups, it's not as if the the Irish or the Italians or the whatever, the other people that they were trying to kind of, lessen their numbers were really that threatening. It was more that their like deviant perception of them was threatening. So anyway, when it comes to eugenics, it's really important to understand the kind of hierarchy, the social understandings of who is the best, right?